Hi everyone, and welcome back to the show. We're here today with a brand new Wellness and Weight Loss Wednesday, where I want to bring you the topic of fluoride and actual new developments that have been happening over the past few months to few years that if you are not aware of, I want to make sure that you absolutely do know about this for yourself, your family, your friends, because fluoride toxicity is one of the most overlooked poisons that we put into our body on a daily basis. And now the virtual 100% consensus is that the toxicity absolutely is not outweighed by any benefits that you come up with about strengthening the teeth or bones. So here's what I want to do. I want to give fluoride a fair shake as to why people are promoting it. So people have promoted fluoride now for many years. Many people say, well, it was left over from the industrial and war-based complex. They needed to find a place to put it, so they started to look for what it might be good for. And since it's naturally found in the soil, it's naturally found in rocks, it's naturally found in water to small trace amounts because it is a natural element, that, well, we'll begin to build this as something that is strengthening for the teeth, mainly for the teeth. The dental-based profession has obviously been using this now in dental-based trays and fluoride in toothpaste, fluoride in mouthwash, and believe it or not, even fluoride in infant-based water that's really marketed as just a marketing technique because infants having no teeth, giving them fluoridated water absolutely makes zero sense, and we'll get into that in just a moment. But the reason why I'm bringing this today is actually we're finding some really detrimental and scary research on unborn children, small children, what it does to their body, and then also all sorts of issues potentially with cancer and definitely with thyroid and other issues. So I'm going to bring you the straight facts today. I mean, this is completely unbiased. I've spoken about fluoride before. It's one of those things that we all think that we need, especially growing up. The dentist tells us to use our fluoride toothpaste, to use all these fluoride mouthwashes, whatever it might be, and they never tell us the other side of the story. So it's very disconcerting for anybody, especially parents, to be able then to see this research that is out there and realize that absolutely, any potential benefit for cutting down on cavities is certainly outweighed by the toxicity of fluoride. And besides, people were doing okay with their teeth before fluoride existed. The issue is, we talked about this before, but the issue is anaerobic-based bacteria in the mouth, too much processed food, etc., right? I mean, we have to really keep that in mind that people had good teeth if they were eating a good diet. This was absolutely proven out by Weston Price and his research on nutrition and physical degeneration. So one thing, I'm going to be bringing all of this to you here today, try to bring it as concisely as possible, but we now know there's all sorts of dangers associated with fluoride. There's minor things like skin issues, acne, some skin rashes. Not that that's minor, but that's minor compared to then cardiovascular problems, hardening of the arteries, calcification in those arteries, higher blood pressure, myocardial damage, cardiac insufficiency, which the heart's not pumping well enough, and heart failure. There's also potential low reproductive and fertility issues. There are hormonal imbalances in both men and women. There's absolutely thyroid dysfunction. We know that from Germany, where they used to use fluoride as actually one of those ways to treat Graves' disease, which is a higher production of thyroid hormone, a lower TSH. There's also issues with osteoporosis, osteoarthritis, potentially with bone cancer, with TMJ. There's neurological issues with learning and ADHD in children. And then we'll be talking about the lower IQ scores in children given fluoride. And I don't even mean given fluoride, meaning like no parent is specifically saying, here, take these fluoride capsules, although believe it or not, there's some of those out there. But what they're doing is they're just going by what the media says. They're going by what their doctor has told them or dentist has told them, and that's to use fluoride in toothpaste, to use fluoride in the water, to use fluoride in your mouthwash. And one of the bigger issues is that science has always said, well, there's not enough in water, there's not enough in toothpaste to actually be at a toxicity level. But remember, that's at a poisoning level. That's when you need to call poison control. Literally, it's like you are dying because you swallowed toothpaste. And believe it or not, it actually says that, seek emergency help if your child swallows fluoridated toothpaste. So believe me, like there's a very fine line between fluoride poisoning and fluoride, I would just say overall toxicity. And the problem with all of these minerals and metals specifically that aren't good for us is the continued exposure, which is never studied. That's always the issue, is that sure, a little bit of aluminum in the water, a little bit of fluoride in the water, no big deal. But the problem is if someone doesn't have a great detox capacity for their body, whether it be genetic wise or other factors going on, then their body begins to accumulate and hold on to these specific metals or toxins. So what I'd like to share with you right now, I already talked about naturally fluoride occurs in the water, soil. It's going to occur in rocks because, again, it is an element and even sometimes just in the air that we breathe because, again, it's in the environment. But again, at microscopic trace minerals, all right? So it's a very, very fine mineral. The way that we typically get it is through dental trays. When you're at your dentist, if you're not going to a biological or a holistic dentist, you're probably having fluoride trays put in. Our dentist would never do that, for our kids, but that's because they've read the research and they understand, and they're part of a different organization, which I will share with you. I've shared this in the past. This is new updates, though, that I'm sharing you today. I mean, that's why the podcast, I want it to be a living, breathing thing. I want to be able always to keep you in the know and up to date, and that's absolutely what this show is all about. So a couple years ago, sure, I talked about fluoride. Now you're getting the latest and greatest news. So children are most likely exposed to it at the dentist with dental trays at a larger degree, and then a smaller degree, they're getting it in their toothpaste. This goes for adults as well. By the way, this is for adults, same thing. I'm not saying just kids. They're just harmed to a greater degree, and then it accumulates, and then as an adult, you end up with all these specific issues like thyroid, etc. So malt rinses, malt washes, in certain supplements, it's in there, believe it or not. It's in infant water, which, by the way, I think is the most insane thing that I've ever seen, that we're giving fluoridated water on purpose to infants when we know it lowers IQ and cause devastating issues within the body, especially since infants and young children, their detox capacity is not very high. It's not high at all. I'm going to be bringing you formula, children or infants and toddlers given infant formula with fluoride and fluoridated water, meaning mixing it with your tap water. And I'll also share with you how you can find if you have fluoridated water in your county. I'll share a link with that. It's a buried link on the CDC's website, Center for Disease Control. They talk about fluoride, okay? So this is really important. We all know about it, but we kind of like to sweep it under the rug because we have 50 plus years of, close to it, of fluoride and mercury use in the dental-based organization. And of course, they don't want to be found out as these things were dangerous and being used all along. To a lesser degree, besides the water, everyday tap water, the toothpaste, and the malt washes, there is also medical imaging scans. There's some fluoride, there's some PET scans, some PET scans, cleaning agents. Some cleaning agents have fluoride because it is quite strong. It's in some pesticides, and it's also used to make Teflon, which we know is a known carcinogen. So we certainly don't want Teflon pans, and some aluminum-based products, which we're trying to stay away from, aluminum pans and cookware as well. So again, I'm going to link up all of the research and all of the links that you need at stephencabral.com/1713 is today's show. stephencabral.com/1713. And also, if you want to head over there right now, if you're not already on that page listening to the podcast or watching today's video, I'm going to link up where to find out if you have fluoride in your city's water right now. Okay, so let's move on. Next part to our research is this. So, and I want to share this with you because this is kind of the latest and greatest on what is going on. And I'll get to the thyroid part in just a minute. And so let's move over to where Harvard University, obviously very prestigious school, brilliant doctors coming out of there, brilliant PhDs, Here's basically the headline. Harvard researchers link fluoridated water to ADHD, autism, and other childhood mental health disorders. Now, before I go on and read this specifically to you, I just want you to understand is I don't believe that fluoride is the only causal factor tied to ADHD, learning disabilities, autism, etc. I don't believe it's the only thing, but for sure, it's filling up that rain barrel, right? And we're beginning to understand that the rain barrel is really what causes and leads to dis-ease in the body. Meaning, okay, you get a little bit, you get a little bit, you get a little bit, no big deal, and then all of a sudden you continue to fill it up, you're never detoxing, your body's not eliminating faster than it's taking in, and then all of a sudden, okay, now we get all these diagnoses. So here it is, I'm going to read it specifically to you, and then I will link it up. Attention deficit hyperactivity disorder, ADHD, is on the rise in America. While there are plenty of pharmaceutical drugs that medicate children with ADHD, these medicines do not treat the underlying cause of the disorder. In recent years, a growing body of evidence has suggested that fluoridated water is responsible for the growth of childhood mental disorders from ADHD to autism. According to a study published in The Lancet, which, by the way, is a very prestigious journal, medical journal, researchers from Harvard School of Public Health and the ICANN, it's ACAHN School of Medicine at Mount Sinai, have pinpointed 6 new chemicals that they believe influence mental disorders in children. The results are based upon a study published in 2006, which identified fluoride as a developmental neurotoxicant, which just basically means a toxin that hurts with the development of a child or the human body. The new study added manganese, DDT, which is a pesticide, by the way, outlawed about 50 years ago, but still in the environment because it does not break down. Tetrachloroethylene, which is a solvent, and polybrominated diphenyl ethers, which I will explain as well, that are inflammatory retardants that also affect the thyroid. To the list of all these neurologically damaging chemicals, fluoride was added. Okay. One more bit to this. According to the researchers, toxic chemicals linked to mental disorders have doubled over the past 7 years, from 6 to 12. This is because many untested chemicals are now being approved fit for public consumption, despite an overwhelmingly massive amount of evidence that suggests the otherwise. So that's always the issue, is that they're testing these things at small parts per million or parts per billion, and they find that no big deal on that one ingestion, right? They'll do it with animals, maybe they'll do it with humans, and they'll say, okay, no big deal. But the problem is that they don't show that, well, what if you get a little bit every single day, right? And it's, of course, not everyone susceptible, but we know it used to be, well, 1 in hundreds, 1 in thousands for autism. And now, then I just remember 10 years ago, it was like 1 in 96. And now it's like 1 in 45. It's 1 in 48. It's double that. And again, I don't believe that fluoride is the cause of autism. I'm not saying that whatsoever. I think autism is multifactorial, dealing with gut, detox issues, other heavy metals, etc. So, but fluoride for sure is one of those. I mean, there's no doubt about it. We look at bromines, we're looking at cadmium, we're looking at these flame retardants, we're looking at manganese, other things like that should not be high, as found in many of the water sources around us, and that goes again, like I said, for tap water. So what I want to do is I want to continue to move on through the science right now. And I want to share with you this specifically. So this was 20 years ago. The EPA actually reached out and they found, and again, this is in 2001. That's why I want to share this with you. And this is what it said. We provide overviews of the scientific research. This is specifically from fluoridealert.org. I will link up the specific page on this health-based issue. But in 2001, the Union of Scientists at the Environmental Protection Agency headquarters in Washington, D.C. stated, "We hold that water fluoridation is an unreasonable risk." So they said 20 years ago in 2001, the EPA, the Environmental Protection Agency, supposed to keep us safe, they said adding fluoride to water is an unreasonable risk. And because of that, we are now dealing again with more than 2 decades after they made that recommendation of health-specific issues. More evidence. In 2017, reports starting to come out to a greater degree that fluoride before birth could lead to poorer cognitive outcomes in the future. So this is why it's so important that we share this information before women get pregnant in an ideal world, because then they can do a heavy metal detox, they can do a liver-based detox, a functional medicine detox, etc. But the researchers stated this. The researchers measured fluoride levels in 299 women during pregnancy and in their children between the ages of 6 and 12. They tested cognitive ability at the ages of 4 and between 6 and 12 years. Higher levels of fluoride were associated with lower scores on IQ tests, and that is not the only test to show that. The higher the fluoride intake, the lower the IQ versus children that were not given fluoride. In 2014 also, fluoride was documented as a neurotoxin that could be hazardous to child development along with 10 other industrial chemicals including lead, arsenic, toluene, and methyl mercury. Okay, we're going on. This is the organization that I look for in terms of finding a good biological dentist for you. And I will link it up today. Again, that's stephencabral.com/1713. It's called the International Association of Oral Medicine and Toxicology, IAOMT. I wrote about it in the Rain Barrel Effect. So this is an organization of essentially dentists and other doctors, and they are speaking out against putting mercury in people's mouths, which is in your body. They are speaking out against using fluoride in dental-based procedures. So this is what along with the IAOMT, the research has found. And again, this is stated on their websites as well as many others, such as Fluoride Alert. Acne and skin problems, cardiovascular problems, including atherosclerosis and arterial calcification, high blood pressure, which can also be from arterial calcification, myocardial, so we're talking about heart damage, heart insufficiency, and heart failure. Reproductive issues such as low fertility and early puberty in girls. We have issues affecting the joints and bones, such as osteoarthritis, bone cancer, potentially, and temporomandibular joint disorder, TMJ, and pain in the jaw. We have thyroid dysfunction, which I'll talk about in just a moment, how that is specific. Again, I talked about this, I've talked about it on previous podcasts for thyroid-based issues, and it's going to be part of my talk for my thyroid accelerator programs as well. So we have neurological problems leading potentially to ADD, ADHD. So ADHD is what's in the research, not ADD, but again, can be affected as well as autism and low IQ scores in children. So let's talk about the thyroid disorders for a moment before I pull it together with the latest research over the past 3 years that has come into our hands. So yeah, we have to understand is that fluoride, and this is well known. So fluoride is part of a haloid group, so it's considered a halogen. And other halogens on the periodic table, there's 5 of them, are fluorine, which is fluoride, chlorine, bromine or bromine and bromides, iodine, and astatine. So when we look at these, we have to understand is that if we are taking in more fluoride, then we might be displacing iodine, which is making up our thyroid-based hormone. And so if we are taking in fluoride and it's displacing iodine, and the body doesn't have enough iodine to then make thyroid molecule, isn't it possible that that could lead to all of the 1 in 5 women with low thyroid and the 1 in 8 or 1 in 10 men that have low thyroid-based symptoms? So that's why, again, there's always a reason why your body's not balanced. Always a reason why. We don't always know the reason right up front, but we can test for these specific things. And that's why it's very, very important. You can test for aluminum and mercury and arsenic and cadmium and lead on a mineral and metals test, the hair tissue mineral analysis, over at equilibriumnutrition.com, or the full heavy metal test, which looks at your bromine and it looks at cadmium, and that's an amazing test. That's just a little prick of blood from the finger and a urine-based test strip as well. So again, you can work with your integrative health practitioner, your naturopathic doctor, or our team over at equilibriumnutrition.com. I just want you to know that the tests are out there and that you actually can access them without having to ask your PCP if you choose not to. Because again, this is not the work of your conventional medicine doctor. This is where we start to get into naturopathic medicine and integrative health. It's quite different actually, and it's okay to have two doctors, it really is, or two practitioners. One can be a IHB and one can be a medical doctor. And I think it is good to have both. Okay, so now that you know how it can affect your thyroid, let's get specifically then into the latest researches, 2017, 2019, and then 2020. And I think by the end of this, you will absolutely see exactly what it is. For what it is, and that is a neurotoxin that breaks down the body as a poison. And so hopefully we can start to put to rest that there's no such thing as toxins, that the body doesn't need to do a functional medicine detox. It does, and we've always known that for 5,000 plus years of ancient Ayurvedic wisdom, and now we can bring it to life through testing. I mean, again, we can do an environmental toxicity test. We can do a heavy metal test. So all of these MDs who switch a little bit into functional medicine and they think that, oh, okay, no, I'll teach people what it's really like. You don't need to do a detox. You don't need to do this. Then you haven't really run lab tests in a clinical setting. You're just saying that from behind your computer, saying that people don't need to detox because you obviously haven't run any of the labs. They've been around for years now, decades now. So we have to just be careful who we're listening to. That's it. Again, I'm bringing you the straight science, and I'm going to link to all of this right now. 2017 Bashash study, intrautero fluoride intake lowers IQ in kids. So this means when a woman is pregnant and she takes in fluoride in her water, fluoride in toothpaste, and it starts to fill up that rain barrel inside of her body, well, that is also then moved through the placenta to her unborn child. And what happens then, especially if they start to take it in even as an infant and child as well, because their formula is mixed with tap water, or the mother continues to take it in and it's in her breast milk, well, now those children are going to have a lower IQ. And that's scientifically proven now. 2019, first study for 2019, the green study shows low fluoride exposure lowers IQ in kids. That means even at a low level of fluoride, it still lowers the cognitive, the thinking ability of children. And by the way, that stays with them most likely for life. Another 2019 is called the Riddell Study. The Riddell Study shows fluoride in water linked to ADHD symptoms and the diagnosis of ADHD. Again, these studies look at specifically fluoride link with ADHD, with lower IQ. It is there. Trust me, it's there. And then in 2020, this year, the TIL study shows fluoride lowers IQ of formula-fed babies. And again, if we know it's affecting babies, if we know it's affecting children all the way up, we have studies till 12 years old, we know it's affecting us as adults as well. Even if you take nothing else, you can see potential for bone cancer, potential for kidney disease, potential for sure for thyroid-based issues, heart issues, blood pressure, and those are adult-based diseases. So I want you to understand that this is not something of natural-based health. This is a real medical issue that is being swept under the rug because the dental-based industry and our cities have been putting water or fluoride in our water now for decades. Just a couple quick facts to leave you with. 97% of Western Europe no longer has fluoride in their water if they ever had it at all. Western Europe is much better than the United States at saying no to all of these genetically modified foods, no to all of these toxins in our water. Many children now exceed recommended daily fluoride intake from toothpaste alone. That doesn't even count water. Fluoride is not a nutrient, no matter what your dentist or other doctors try to tell you. And 64 studies have linked fluoride with reduced IQ in children. This is no longer a maybe, no longer a theory. It is scientific research and proven. Do not wait for the dentist industry to finally take fluoride out of your toothpaste, your dental trays, etc. Look for a non-fluoride-based toothpaste. You can find them at my resources at stephencabral.com/resources. 99% of those are not my products at all. There are other companies that I trust. And what I'll do today, because I know many of you might want to look at more, research more, and talk with other people, and that's totally fine. Again, my job is to bring you the information, and then what you do with it is up to you. But again, you can share this information all based in science. I'm going to link up all the links and also to see if your water has fluoride at stephencabral.com/1713. Thank you so much for tuning into today's show. And as always, if this show is helpful, please do feel free to share it with anyone you believe it could serve. Take care.